Hello, it's February, which is Heart Month here on our page at NICUeducator.Lisa. And this week, February 7th through 14th, is Congenital Heart Defect Awareness Week. I wanted to jump into this week prior to talking about defects, which is what we're going to do, and do some review from previous posts and talk about the normal blood flow through the heart, give a quick example of cyanotic and acyanotic so that you have a basis of understanding prior to moving in. So let's into our other teaching. So let's talk about what it means to talk about normal blood flow through the heart. As we know, blood comes into the right atrium via the superior or inferior vena cava. The blood is deoxygenated. It's already spent its time going out there and dropping off oxygen and picking up carbon dioxide. It enters into that right atrium and then goes into the right ventricle and then goes out via the pulmonary arteries. How I remember this is arteries are away. So we're going away from the heart into the lungs, where it's going to drop off the CO2 and pick up the oxygen. After it picks up the oxygen, it travels back to the heart via the pulmonary veins. So we're going into the heart, onto the left atrium, into the left ventricle, and then out to the aorta. So here's the picture, right? You can see kind of what's happening with this normal blood flow through the heart. What I also wanted to point out is something that tremendously changed my understanding of congenital heart defects is the idea of what color is the aorta. So if you're looking at this picture and you're saying to yourself, okay, what is this heart defect? If the aorta is red, it's an acyanotic heart defect. If the aorta is purple or blue, it's a cyanotic heart defect, right? The baby is going to be purple or blue. The aorta, as you remember, pumps the blood out into the body. So it's what the baby is going to be a reflection of, is the aorta. So think about what color is the blood going through the aorta, and that's going to help you understand cyanotic versus acyanotic. So for example, let's talk about transposition. Here we have transposition, and that is when the pulmonary artery, the thing going away, and the aorta are flipped. So now we have our aorta coming off of our right ventricle. And we talked about how the right side of the heart's job is to pump unoxygenated blood to the lungs so they can pick up the oxygen. Well, it's going to pump this unoxygenated blood out to the body because the aorta is attached to it. So the aorta is going to be blue, so the baby is going to be blue or cyanotic, right? We're going to have this cyanotic baby. So transposition, they're in different places, is a cyanotic heart defect. Let's go on the other side, aortic valve stenosis. So in aortic valve stenosis, the aortic valve, so that little valve that allows blood to go up and out to the body, is tight, right? It's like a tightening rubber band or a clogged drain. And so the blood just can't get up. The blood is still oxygenated. It still comes from the lungs into the left atrium, into the left ventricle. So it's still getting in there with oxygen. It's still red. So the aorta is going to be red. Therefore, this is an acyanotic heart defect. So transposition, which we talked about, where the aorta is going to be blue, is a cyanotic heart defect. And aortic stenosis, where the aorta is going to be red, is an acyanotic heart defect. And then we're just going to quickly touch on coarctation of the aorta. So coarctation of the aorta is considered an acyanotic heart defect. And that is because the blood is still coming from the left atrium to the left ventricle up the aorta. It's just that it's getting stuck there. And in the setting of your patent ductus arteriosus, depending on where it is, there may be mixing of blood. And so you might have a baby who shows some cyanosis and has some drifting in their saturations, but it's not going to be as severe as your transposition. So if you look at the transposition versus the coarctation, you can see that they're not going to be quite the same. And a severe coarctation, and depending on where it is in the aorta, also can be more severe, and the baby could become more and more cyanotic. So that's a quick review of normal blood flow through the heart, right? This is what I want you to be picturing this whole time when we go through this week of the different cyanotic and acyanotic heart defects and what those mean. We're going to briefly touch on them on the YouTube videos again. As you know, our Instagram posts are static posts, but every Instagram Teach Me Tuesday has a YouTube video. So go check those out. I hope you enjoyed this week. We're going to cover a lot, and I'm going to refer you back to previous posts that I have done so that you can learn more. Have a great week.